Hello everyone and a very good day to you all. We are celebrating 8th anniversary of Global GHK and it is indeed an honor to be here presenting my case on this prestigious platform. Thanks to Dr. Asha for this opportunity. I'm Dr. Siddhesha, a practicing homeopath at Dr. Asha's clinic for the past 5 years. And German New Medicine has been a part of my practice ever since then. When I look back, I wonder how German New Medicine has proved to be promising in my clinical practice so far. It is fascinating to see how every patient's mental and emotional history aligns with Dr. Hammer's discoveries, particularly the connection between their conflicts and the organs affected. So, without further delay, let's get into the PPT. So, my today's topic of discussion is unraveling the mysteries of cardiovascular system. Dr. Samuel Hahnemann and Dr. Gerd Hammer. I'm thankful for their novel and supreme discoveries in the field of medical science. And my gratitude to Dr. Asha Sheikh, who has been my guru and role model. I'm forever grateful for his guidance, faith, and opportunities to grow. His teachings has gone beyond the classrooms of medical school, inspiring me to be a better doctor and a person. Thank you for being an incredible mentor. Disclaimer. So here we are. The components of cardiovascular system. Cardiovascular system is a very huge topic and it is very difficult to take all its aspects in one single lecture. So I'll try to take one aspect of it in this lecture. The components include heart, blood vessels, and the blood. So the so-called incurable pathologies of vascular system that we can completely cure with homeopathy by knowing German New Medicine are hypertension, gangrene, stroke, atherosclerosis, varicose veins, leukemia, anemia, heart ischemia, and whatnot. Some diagnostic blood test, that is lipid profile, high sensitivity CRP, troponin test, brain natriuretic peptide, etc. are some of the blood tests that are done to diagnose the pathologies in the heart and cardiovascular system. Also, the imaging tests such as ECG, stress test, echocardiogram, coronary angiogram, cardiac MRI, CT scan are also done for diagnosing heart pathologies. But there are few patients who cannot afford all these blood tests and imaging tests. So how can we diagnose the heart pathologies in these patients even without having these test reports? The answer lies in further slides. For all these above conditions that I had mentioned earlier, the modern medicine has no solution. No solution, that means no cure. They can only offer palliative or surgical options with no certainty of complete cure. Why? Because they have been digging into the wrong cause. The cause which needs to be addressed is not found and not treated in these modes of treatments. So how are we different? German New Medicine. This is something written by Dr. Caroline in her Learning GNM. The German New Medicine is not only a new paradigm of medicine, but is also a new consciousness. It is the awareness that our organism possesses an inexhaustible creativity and remarkable self-healing capabilities. It is a recognition that each cell of our body is endowed with a biological wisdom we share with all living beings. So, what is German New Medicine? German New Medicine offers a close connection and a relation between psyche, brain, and organ, a combination of all these three, which help us to get into the cause of disease and to help to treat that disease from their roots itself. According to German New Medicine, there are no diseases, but the adaptations of human body to the external and internal stimuli or the conflicts, which is something that resonates with Darwin's survival mechanism, and we all know about it. Dr. Hammer has explored different facets of cardiovascular system, which are very intriguing to know and experience in our clinical practice. His explanations on the occurrence of heart attacks challenges the modern theory of atherosclerosis being the root cause. In this lecture, we will try to understand one facet of cardiovascular system through a unique case. So here is the case, a case of cerebrovascular accident. I'll read it for you. A 65 years old male patient came to the clinic on 26th of March with presenting complaints of pain over vertex with giddiness, forgetfulness for recent and old events. According to his wife, sometimes he also forgets his wife, her. He cannot remember the name of the known people as well. Patient says, जिंदगीमध्ये काय केलं आहे ते सगळं विसरलो आहे. He has forgotten everything that he has done in his life, and also irritability. He is a known case of diabetes since 2018 and hypertension since 2021. He has a history of cerebrovascular accident, left middle cerebral artery territory infarct in March 23 with thrombocytopenia. It was diagnosed through MRI as he was getting tingling and weakness in his right arm with headache. When he came to the clinic, we examined and his BP was 130/90. On 5th of March, patient started feeling giddiness. So he went to the doctor who prescribed him some medicines. Next day, he started getting pain in head, typically over vertex, which was throbbing in character. He started becoming restless, and after 2 days, wife observed that he was forgetting small things like names, words, what he had in lunch or dinner, etc. The doctor prescribed him medicines for a few days, but he had no relief, so MRI was obtained. After looking at the reports, the patient was admitted and standard treatment protocol was followed. So this was the presenting complaint, and here is the report of MRI of his brain and angiogram. What does it say? Moderate size, fresh non-hemorrhagic infarct in left temporo-occipital lobe parenchyma, small gliotic area in right parieto-occipital cortex, few lacunar ischemic changes in bilateral cerebral hemisphere, cerebral atrophy, flattening of bilateral carotid bulbs, and moderate narrowing of P2 segment of left posterior cerebral artery. So after listening to his presenting complaints and reading his reports, we knew, according to German New Medicine, that we had to find some conflict in this case. So we started questioning, and here comes the life story of patient. A patient comes from a very low socio-economic background. His family consists of a wife, daughter, an elder brother, his wife who stays in the village with their parents. The patient has a vada pav stall from where he earns his bread and butter. During case history, his wife was accompanying him and she gave us most of his history since he did not talk much. His youngest daughter got married in 2021 during the time of COVID, and 2 days after marriage, patient started suffering from profuse perspiration, palpitation, weakness, and restlessness. He was taken to the hospital. ECG was drawn, which came normal, but his BP was shoot up and BSL was high. He was prescribed antihypertensive and antidiabetic medicines and was sent home. After a week, patient felt better, so he stopped BP medicines on his own. Yes. So these were the questions which we asked to find out the conflict in his life. Everything was going smooth for a while, and few months later, patient came to know that his daughter's in-laws were troubling and abusing her. This made him anxious and started worrying about her day and night. Within a year of marriage, daughter came home and her in-laws filed a case of divorce. Let's see what patient says. Her in-laws wished for a quick marriage, so I hurriedly got her married. However, only after a year of marriage, They got divorced. Those people were awful. They used to abuse her, so I was concerned for her well being. My daughter was against this marriage since the beginning. But at that time, it was challenging to make arrangements of 4 lakhs rupees for the marriage. I don't like to borrow money from anyone. Why to trouble others? I don't like enjoying on others' money. So I still borrowed the necessary funds from here and there and managed the situation somehow. I'm still making repayments on the loans, but I'm not worried about that money now. However, I made a big mistake by making her marry that guy. I kept her from having the happy marriage she had always dreamed of. I got 3 of my daughters married without ever feeling sad, but now I feel accountable for this daughter's condition. I should have thought about it before, but I only listened to my brother and in-laws and her in-laws. My daughter have my support. I will arrange her marriage again. Everything will be fine. I feel I have this disease because I keep thinking about old incidences. I worry about my daughter, but I know she will find her way. I have never told this anyone to anyone about this. I keep everything in my mind. There are some things you should never tell anybody. I'm not worried about money. Whatever I earn daily, I hand it over to my wife. I don't have any habits, so this is how I pulled my marriage. Now I'm only worried about my daughter. I feel guilty because she's sitting home because of me. When my daughter got married, I sought my brother's advice. He's elder, so you need to show respect. They would never ask or discuss anything with me, but I do because we are younger than him and we should ask. They would offer some sound guidance. According to his wife, his nature is very mild, but when he gets angry, he becomes violent. But that happens very rarely. Even neighbors say that we never hear his voice. Nowadays, his irritability has increased. He was stressed but never told me. He was strong, has been worried about work but never took money from others. Rather, he lost himself by giving money to others. He respects his brother, but brother deceived him. He purchased a land and gave it to brother. At that time of separation, brother said he would give 10,000 rupees to us but never gave. And he also never asked. So doctor asked, why don't you ask for your money? Patient says, why should I ask? Why to ask? Wife, he would never engage in combat over money. Never ever reminded him. He has maintained their relationship. Even now, when his brother comes home, he makes sure to feed him and get snacks for his kids from our stall, even if he doesn't have a single rupee in his wallet. In 35 years of marriage, we never fought. I get angry easily, but he tells me not to speak loudly. Why to make scene in front of others? He had to borrow money from others at the time of marriage. That must have affected him, but he never expressed his stress. So these are all the things that we gathered from the case. We have to find the exact conflict for his condition based upon the knowledge and information that he has shared so far. So before moving ahead to the conflict and analysis of the case, let us understand the origin and control centers of cardiovascular system. Heart and blood vessels. Both are the different things, different organs, and they are developed at different times during the process of evolution. So they are derived from different embryonic germ layers and are controlled from different parts of the brain. They relate to the different types of vascular pathologies and all are linked to the different biological conflicts. Okay, so the pathologies of heart and blood vessels are completely different, and so are their conflicts and the seat of and the part of brain that controls them. In this case, our concern is cerebral arteries. So let's understand arteries through the perspective of German new medicine. The origin and control centers of the blood vessels. The main point of concern here in cases of arteries is tunica intima. This tunica intima originates from new mesoderm and is controlled by cerebral medulla. Tunica intima is the layer of artery which is the innermost layer and which is going to be susceptible for the effect of conflict in the conflict active phase and healing phase. So we will be concentrating on tunica intima through this lecture. There is a crossover correlation from brain to the organ in case of arteries. The arteries and veins of the right side of the body are controlled from the left side of brain, whereas the arteries and veins of the left side of the body are controlled from right cerebral hemisphere. So here is the principle of laterality that follows. In right-handed person, the right side belongs to partner, father, spouse, territory or work, whereas left side belongs to mother child or siblings. Opposite happens in left-handed person. In them, the right side belongs to mother child or sibling and left side belongs to partner, father, spouse, territory or work. The coronary arteries, coronary veins, ascending aorta, internal carotid arteries, inner section of subclavian arteries, and carotid sinus. These originate from ectoderm and thus are controlled from post-sensory cortex. Whereas cerebral arteries, descending aorta, external carotid arteries, outer section of subclavian arteries, abdominal aorta, and blood. All these things originate from new mesoderm and thus are controlled from cerebral medulla. The biological conflict for arteries is light self-devaluation conflict. So this self-devaluation conflict has to be found in our case. What is self-devaluation conflict? Let's understand through these rubrics. The rubrics are the language of repertory that we use in homeopathic practice. The examples of self-devaluation conflicts are humiliation, abuse, failure, poor performance, guilt or shame, and loss of status. The rubrics that follow are reproaches, reprimands, indignation, that is insult, being criticized, being scorned, being despised. Abused could be sexual, physical, mental. Failure, literally, literary, scientific failure, examination failure, fear of not being succeeded, reproaching oneself, feeling as a failure as a parent, as a partner, or as a child. Less confidence, self depreciation, feeling of worthlessness, delusion, wrong done, and contemptuous of self. Shame, remorse, guilt, embarrassment could also be called as self-devaluation conflict, loss of position, despair about social position, having lost his job are some of the examples of self-devaluation conflict. Our concern here in this case is cerebral arteries. So every artery, depending upon its location, has different self-devaluation conflict. In this case, the cerebral arteries or arteries in the head correspond to intellectual self-devaluation conflict. What is it? Failing an intellectual task at school, at work, or by having made a mistake. Mistake in school, in writing papers, at work, etc. Condescending remarks of teachers, coaches, employers, colleagues, parent, or partner making a person feel slow or stupid. People who have an occupation that is intellectually demanding, such as scholars, academics, writers, and others, whose self worth is built on their intellectual achievements or are academically overambitious. Self talks, such as I'm an idiot, I'm not smart enough, can generate a self inflicted loss of self worth. The fear of failing might already activate the conflict. Unexpected injustice. This is not fair. Things going against your wish, the things that are not according to justice, can also cause intellectual self-devaluation conflict. So this is what German New Medicine has to say. The arteries are originated from new mesoderm and thus are controlled from cerebral medulla. The conflict for arteries is self-devaluation conflict. During conflict active phase, there is necrosis or cell loss in the intima of the walls of arteries. And in the healing phase, the additional cells are removed with bacteria and there is cell proliferation. What happens in the conflict active phase when the arteries are affected by self-devaluation conflict? There is localized necrosis, as I mentioned earlier, cell loss. So, with recurrent cell loss, the smooth muscles of the arteries becomes thicker in order to prevent the perforation of arterial wall. When the conflict is persistent, in that case, the vessel wall becomes weakened and there is a formation of localized bulge, which is called as aneurysm. In case of trauma, pressure, or vigorous exercises or moves, these aneurysms can rupture. This is something that happens in the conflict active phase of any artery. Mostly, the aneurysms occur in abdominal aorta, cerebral artery, etc. Now comes the healing phase. We saw in the conflict active phase here, this is cell loss. What happens in the healing phase? There is exudation or edema in PCLA. This is called as cell proliferation. The blood vessel, the area which was necrosed in the conflict active phase, that cell loss is repaired with the help of calcium and cholesterol. The bacteria, if available, assist the healing process, potentially accompanied by an inflammation or arthritis. So, arthritis occurs in the healing phase. With continuous conflict relapses, the cholesterol plaques accumulate at the site of necrosis, leading to atherosclerosis and eventually to a narrowing of the lumen of the blood vessels. Over time, the arterial wall hardens and the elastin fibers in the arteries loses its elasticity, a condition which is known to us as arteriosclerosis. So what is the purpose of cell loss? See, this is something Dr. Hammer has mentioned. Everything that happens in the human body has some reason. So there has to be a biological purpose, some reason for the cell loss to occur at the level of arteries. What is that reason? It is to widen the lumen of coronary vessels or any vessels so that the more blood can flow to the heart or to that organ. This enhanced energy puts the individual in a better position to get their territory back or established a new one in cases of coronary arteries and to fight that self-devaluation conflict in cases of other arteries. So, what is the role of cholesterol? There are two types of cholesterol known to us. One is HDL, high density lipoprotein, which is called as good cholesterol, and low density lipoprotein, which is called as bad cholesterol. 80% of this cholesterol is produced by the liver, and rest of it we get from the dietary food. In resonance with modern medicine theory, what happens is the injury to the blood vessel wall due to cell loss in conflict active phase, there the inflamed endothelium, it becomes susceptible to the circulating fatty particles, especially LDL, and attracts them. So these LDL cholesterol particles make their way into the endothelial lining and activates the platelets. Now these activated platelets adhere to the damaged endothelium, forming the clot. This is the physiological healing mechanism in the response to any internal injury. But why LDL? The so-called LDL cholesterol, labeled as the bad cholesterol, is particularly useful as it is very sticky and therefore ideal for repairing the blood vessel wall. That is why in cases of arterial damage, we see LDL cholesterol getting accumulated in that area. And this is called as atherosclerosis by modern medicine. So this is something Dr. Hammer says. Making a link between elevated cholesterol and the onset of a heart attack is a fundamental error in scientific reasoning. Cholesterol is important for the cardiovascular health. It is a necessary ingredient in any sort of cellular repair. So, the cholesterol that is elevated in this condition has come for some of the defense mechanism of the body, which is repairing the arterial wall. If this wouldn't have come, the arterial wall would break. To prevent the breakage and bursting of the arterial wall, the cholesterol comes, adheres, and forms the clot. That means the LDL cholesterol circulating in your blood is not harmful to your cardiovascular health until that LDL cholesterol becomes oxidized. Now, what is this? The LDL cholesterol, why does that get oxidized? The excessive amount of cortisol contributes to the release of free radicals, excess of which generates oxidative stress and thus responsible for oxidation of LDL. So, the oxidation of LDL is caused by excessive amount of cortisol. Now, from where that excessive cortisol comes? It comes from the hanging healing phase, the situation where the healing phase cannot be completed because of recurrent conflict relapses. When the conflicts keep coming recurrently, in that case, this healing phase is not completed and the patient goes back into conflict active phase and healing phase, again active phase and healing phase. This keeps on occurring and patient doesn't heal. And in this condition, the excess cortisol comes and which causes oxidation of LDL. What is atherosclerosis? With hanging healing, which is something we saw before, this is when the healing process is continuously interrupted by conflict relapses, the buildup of cholesterol plaques lead to atherosclerosis and eventually to narrowing of the lumen of the blood vessel. Okay, so what happened in our case? There was narrowing of the posterior cerebral artery and a non-hemorrhagic infarct in the brain. This we saw in the report of MRI. Why does that occur according to modern medicine? It is because of the cholesterol. This cholesterol leads to accumulation of fatty deposits in the cerebral arteries, reducing the supply of blood and oxygen to the brain, causing infarct. So this is the atherosclerosis. Let's see the analysis of the case. We'll first arrange his symptoms and diseases in the order of their appearance. He got diabetes in 2018 and transient hypertension in 2021. He got an episode of tingling and weakness in the right arm and headache in March 23 with thrombocytopenia. Had episode of headache, restlessness and forgetfulness in March 2024. So what conflicts do we find in this situation? Pancreas, beta cells in case of diabetes, the conflict is meal resistance conflict. Right-sided muscles. Muscles are affected, there is tingling. The self-devaluation conflict. Right side is for partner and work. This is what we saw. The ventricular muscles, those were affected and he got hypertension. That was a transient hypertension. And the conflict here is overwhelming conflict. And the platelets, thrombocytopenia. Here comes the self-devaluation conflicts. So all these conflicts has to be there in a patient. But something is wrong. Here, it is not a self-devaluation conflict related to partner or work. Why not? Let's see. What is given in the reports? Left middle cerebral artery was affected, causing a territorial infarct in 23, moderate size infarct in left temporooccipital lobe parenchyma, narrowing of left posterior cerebral artery, and gliotic area in right parieto-occipital cortex. So, left-sided artery was affected, and we have seen that there is a crossover correlation from brain to organ in cases of arteries. So when left side of the artery is affected, The results will be seen in the right side of the body. So what we have to consider is left-sided organ affection. The primary organ of affection was left middle cerebral artery. And what is glioma? The glioma was also seen in his reports. After the brain edema has been pressed out, when does that occur? In the epileptoid crisis. Here, the glial cells proliferate at this site to finish the healing process on the cerebral level. Neuroglia. The glia comes from the Latin word glue. The neuroglia is a brain connective tissue that insulates and supports neuron. Only 10% of the brain consists of nerve cells. 90% is made up of glial cells. And the glial cells help to restore the area in the brain that received the impact of DHS, that is cell loss. The glioma in right parieto-occipital cortex in our case suggests involvement of the right insula. Here there is no crossover correlation. The right ventricular myocardium was affected, which caused suppression of motor heart rhythm center for slow heartbeat. Here it is on the right side. It is a motor heart rhythm center for slow heartbeat, that is ventricular bradycardia. The glioma was present here in the right insula. That means this area of the brain was affected, and this area is responsible for motor heart rhythm center for slow heartbeat. So in this condition, this area was suppressed, and in that case, the left side of the brain, this becomes dominant. When this becomes dominant, what is this? It is the area for fast heartbeat, for ventricular tachycardia. So what will happen when this is suppressed? This area becomes dominant, and this leads to ventricular tachycardia and high blood pressure. This is why our patient had high blood pressure. And also in that case, the glioma was also present. Glioma comes when? In the healing phase. That means patient had glioma and he had high blood pressure. So this glioma is linked to his high blood pressure. So we will understand what I said with this slide. The right myocardium is known for pulmonary circulation and has low pressure system, because low pressure is required for pulmonary circulation. And left myocardium is a systemic circulation, and it requires high pressure system to deliver that blood to the entire system. This is what we know. So during right myocardial heart attacks, the low pressure system is temporarily deficit, and there is dominance of high pressure system causing high blood pressure. And during left-sided myocardial heart attacks, the high pressure system is temporarily deficit and temporary dominance of low pressure system causing low blood pressure. And in both these cases, the cholesterol is normal. This is something related to the heart attacks, related to myocardium. This is not the part of our discussion and our case, but just to make you understand what we had seen earlier, I'm referring these slides. Now, in our case, the presence of glioma suggests past episode of epileptoid crisis. That means the patient had suffered a minor heart attack in 2021 when he was stressed about money matters. Okay, the heart attacks occur in the epileptoid crisis. So, the glioma suggests presence had past episode of epileptoid crisis. That means a minor heart attack. Now, why minor? Dr. Hammer has mentioned that when the conflict situation is mild in intensity and lasting for short duration, its effect is minor. And when the conflict situation lasts for longer time, the effects are more concerning and more destructive. In this case, his condition was minor. Why minor? Because the stress was lasted for a very short period of time. What was the stress here? The overwhelming conflict. What was that conflict? Having to borrow money against his ethic. this was an overwhelming conflict for him and thus cause of hypertension. And we had seen this earlier that this hypertension was transient. When he came to us, in that period, his blood pressure was normal and he was off the BP medicines. After the marriage, the conflict was resolved as he started repaying the loan amount and his BP came to normal and he stopped taking antihypertensive medicines. That means the duration of conflict activity was small and thus the effect was also minor. But after knowing about the abuse of his daughter, he was more worried and he went into recurrent self devaluation conflict. What was the self devaluation conflict here? That I made a mistake. I should not have got her married. And this has happened to her because of me. He was constantly thinking about that situation. This led him to hanging healing phase. And after multiple episodes of conflict, he landed in the epileptic crisis related to the cerebral artery and developed cerebral infarct twice. So the conflicts involved in this case were male resistance conflict, intellectual self-devaluation conflict related to mother, child or sibling. Why? Because the left side of the arteries were involved. And the overwhelming conflict responsible for hypertension. Based upon all these conflicts and the information that we gathered from the patient, we formed the totality and the medicine was given Ignatia 200 3 doses along with the counseling and making patient aware about the conflicts. After that, the follow-up was done after 15 days and here is what patient says.
नमस्कार काका, कशी आहे तब्येत? मस्त आहे. मस्त आहे. काय काय फरक वाटतोय आता? हो, फरक 80% पडला. अरे वा. डोकं दुखणं? डोकं कधीतरी दुखतंय. ओके. आणि विसर तरी विसर पडायचं? नाही, विसर ते नाही फरक पडत. विसरणे फरक पडत, फरकच पडत नाही. आणि जे डोक्यामध्ये दुखायचं ते कमी आहे ना?
सर, त्यांचं ना डोकं दुखायचं ना, दवाखान्यातून आल्यानंतर 10-12 दिवस लगातार तुम्ही दिलेल्या गोळ्या दिल्या मी त्यांना, डोकं टाइम एक टाइम. पण आता 4-5 दिवसापासून बंद आहे. जे गोळ्या ते म्हणतायत की नाही दुखत आहे डोकं.
गुड. पहिले तुम्हाला पण विसरून जायचे ते, आता
आता नाही. आता सगळ्यांना ओळखतात ते, फक्त बाहेर जाण्याला भीती वाटते त्यांना. मग ते म्हणतात इकडे जायचं का इकडे जायचं, म्हणजे त्यांना असं सुचत नाही पटकन.
गावाचा नकाशा. पण घरातल्या लोकांना तरी आता ओळखताय ना?
हो, ते सगळं क्लिअर आहे. बाजार करून आणतात, दुकानावर पण जातात, गिरायकांपासून पैसेही बरोबर घेतात, फक्त थोडं गोंधळून जातात ते.
ओके. हार्टचा काही त्रास परत?
नाही, काही
बीपी वगैरे मध्ये काही वाढलं होतं?
नाही.
बाकी काही नाही ना?
बाकी काही नाही. दवाखान्यातून आलो तर कुठेच गेलो नाही आणि काही त्रास नाही.
व्हेरी गुड. चलो ठीक आहे.
आतून फक्त डोकं दुखतं आणि विसर पडते.
ओके. झोप बरी आहे?
हो, बरी.
चांगलं. जेवण वगैरे करताय?
हो हो,
करताय ना? चालेल.
Yes. So, what do we see here? Most of his complaints, including his headache, sleep, appetite, and all other pains that are 80% better. He now has started recognizing his wife and family members, but still, the main part is his memory has not completely come back. This is something to be noted. The next follow.
चक्कर नाही येते, पण विसर पडतो त्यांना सारखा. बाकी शुगर वाढली, तुम्ही तुम्हाला त्या दिवशी दाखवलं शुगर वाढली, ते औषध दिला, मग ते 2 दिवसात थोडं त्यांना चक्कर वगैरे वाटायला लागले, बंद केलं.
शुगर डाऊन झाली होती.
कदाचित त्यांनी ते आंबे खाल्ले ना आणि आंबे खाऊन शुगर चेक करायला लागले.
ओके. डोकं दुखणं?
डोकं दुखतं पप्पा.
डोकं हाताने असं नाही दुखत. चिडचिड?
चिडचिड करतात.
खूप
पण होते त्यांची चिड. आणि विसरतात म्हणजे आपण काय सांगितले
नाव वगैरे विसरायचे ते?
नाव नाही विसरत, पण असं कुठे काय पडतोच
पहिले लागून विसर पडते. मागचं आठवत नाही. ओके. अजून काय बदल वाटतो त्याच्यामध्ये? फिजिकली त्रास कमी आहे, पण जे त्यांचं विसर पडणं असायचं, कोण आहे काय आहे असं जे असायचं, रस्ते असायचे, त्याच्यात काही फरक आहे की ते तसंच आहे? तसंच आहे.
Okay. So, in this follow-up also, all the complaints are better, but the patient's only concern is loss of memory. That memory he is not getting back. So, is this something we should be worried about? Let's see. Why he is not getting his memory back yet? According to Dr. Hammer's finding, a brain atrophy is a result of repetitive scarring process in the brain due to a continuous conflict relapse of any biological conflict. Okay. In our case also, we found in the MRI report that he had brain atrophy, and brain atrophy is also a reason for his memory loss. So why is he getting brain atrophy? Because of repetitive scarring process in the brain, because he was constantly thinking about that incidents which led him into the devaluation conflict. A short-term memory loss serves the purpose to temporarily forget the one who was responsible for causing the damage to the body due to conflict by blocking the memory so that the person can revive from the stress-induced disease. Once the person is healed, the memory is restored. Okay, here our patient had a short-term memory loss, and this helped him forget the incidences which caused him self-devaluation conflict. But here we have to make the patient aware of the stress situation which is giving him this disease. Otherwise, he may land up in the same situation again. In this case, the situation had happened 3 years back, but the grief is still fresh. He still blames himself for the situation with same intensity, and this would never let him get better. This is why his brain is trying to forget those bitter memories so that he can come out of the recurring conflict. Our role here as a doctor and a German new medicine practitioner is to make him aware of his conflict, the stress that is not letting him heal completely, so that this cycle will break and he will come out of the situation eventually. Besides this, our medicine will make him stronger mentally and physically so as to endure that situation and not let it harm him. Once this is achieved, his body itself is capable of bringing him out of the trouble according to nature's law of cure. So thank you for listening and thank you for this opportunity. Thank you.